It's episode 121 of the Sleep Whisperer podcast. Happy Wednesday. I'm super excited for this episode in which I welcome Dr. Anjali Hooda. Like the powerhouse that she is, she takes us through the depth of autoimmunity and the interconnection between gut health and sleep. This is a no-filter interview where we dive deep into dangerous trends, especially in India, on self-prescription of antibiotics, loose prescription of antibiotics by physicians themselves, and ignorance of the importance of the gut in autoimmunity. Dr. Hooda scoffs at this trend of running to antibiotics for even minor gut challenges, which could just be indigestion itself. Clearly, she's making an impact, and that's why I'm thrilled to have her on the show today. Over the course of the next hour, we discuss the hot topic of autoimmune disease and what they are. She walks us through what we should avoid if we want to keep our gut healthy. We discuss whether the connection between the health of the gut and the autoimmune challenge is overlooked in mainstream medicine. And finally, we look at whether the trend is to ignore the basics of health while looking into complex protocols. I hope you enjoyed this episode as well. An obesity, advanced metabolic and functional medicine specialist, Dr. Hooda studied internal medicine in the US and trained with renowned medical practitioners in US. She also holds a fellowship in clinical nutrition on obesity medicine from US and is an IFM certified physician. Along with her international patients, she now also focuses on the Indian population to give them the best care with a scientific approach. Dr. Hooda is the author of the best-selling book, Think, Eat, Live Smart. She's focused on utilizing her years of learning and experience attained in the US, the bedrock of functional health, to treat people with chronic lifestyle issues in India. Hey everyone, I'm Deepa, Light Functional Medicine Practitioner, author and yogini, and you're listening to the Sleep Whisperer podcast, the only sleep podcast with conversations and meditations. I'm on a mission to share profoundly insightful sleep conversations with global visionaries that merge together functional medicine and ancient wisdom. Breathe in bliss through weekly guided meditations and let yourself enter the land of dreams. Together, let's unravel the pieces, get to the roots, and understand the right tools to transform your sleep completely. Through this podcast, I want you to dream the best version of yourself. It's time to regain hope and begin your sleep journey. Dr. Anjali Hooda, welcome to the Sleep Whisperer podcast. And today we are speaking about gut health, autoimmunity, and sleep. And we've had several conversations on the podcast about gut health. They've all been very popular, and I don't think we can ever speak enough about gut health. And I know this is a passionate area for you. I heard you speak about it at a conference, and there was extensive information that you shared. And I would love for us to get started by just looking into why autoimmunity is so prevalent today, and are people in the general population bringing the adequate attention to looking at root causes and gut health, or is that missing in mainstream medicine?
Yeah, I think the gut health as per se is not recognized by the mainstream medical field, because it's something even a gastroenterologist does not usually recognize this as something that is causing autoimmunity, because the gut barrier which exists, because if you're reabsorbing the toxins back into your circulation, that gut barrier is broken down. But how do we recognize this in the long term? That is what is missing from a lot of practitioners out there. A lot of people find us or find about gut when they are going through something, when mainstream practitioners not able to fix the problem, then people come looking for, functional medicine experts, or they'll come looking for people who know how to treat and, diagnose and treat a gut. So it's sad, but I think, like podcasts like yours, there we can spread more information, people will know more, and they'll seek help, and they'll get tested and treated more often.
And do you feel that when it comes to even understanding autoimmune conditions, that people take a very long time to even realize that they have something which is autoimmune in nature? And how do people actually get diagnosed with something autoimmune?
I think it really matters from condition to condition. Most of the people don't know about. So most common is autoimmune thyroid, the Hashimoto's. So most common people will have hypothyroid, but they probably won't know what kind of hypothyroid they have. So that is one of the most common and easily recognized. And the mainstream practitioners will order the antibodies and everything, and then they come to know it's autoimmune. So once uh, you come to know that this is an autoimmune condition, it will usually be associated with other autoimmune conditions, because autoimmunity doesn't focus on one organ. It basically is, systematic organs. There is a spread, and they will be affected in the long run. And most of the people don't recognize this autoimmunity as something which is bothering them till they actually get diagnosed with an autoimmune condition. Let's say they have an inflammatory bowel disease, or they have rheumatoid arthritis, or SLE, or something. So these are the main diseases by which they come to know there is autoimmunity. And then when they come to know, it's usually too late in the condition to do any preventive method of treating them. So then it becomes more treatment and more counseling, and it becomes slow. The treatment becomes slow because already advanced to a level which is not preventable. But yeah, it can definitely be stopped at the point where it is diagnosed if they seek help in a quick manner.
You mentioned Hashimoto's, and I must ask you this because I've spoken about gluten on so many episodes. However, a lot of times Indians have asked me why a food that we've been eating for several generations should be a problem, especially when I mention it compared to Hashimoto's. I'd love for you to talk a little bit about gluten, given that you bring the Indian perspective. And do we need to be avoiding gluten when, as Indians, we've been eating it forever? And if so, why? How is gluten linked to Hashimoto's in particular, but most autoimmune conditions as well?
The story of gluten is such that it's something which is inflammatory by nature. And because the gluten molecule itself, with time, as we age, it becomes more difficult for it to, get through the gut barrier, and it causes the lining damage. But if you talk about, let's say, we talk about our ancestors eating gluten for so long and nothing really happened. Well, the autoimmunity was not prevalent at that time, one. So we are not saying gluten is causing the problem. We are saying avoid gluten if you have a problem. There are two different things. So it's not like if I'm healthy completely, I should stop having gluten. Well, that's totally a personal choice, because gluten sensitivity is something that cannot be measured. Gluten allergy is a measurable thing, but sensitivity is not measured. It's only when you give up gluten, you'll know that you're sensitive to it. And as far as the gluten is concerned, now the gluten molecule has changed. The wheat has changed from what we were eating when I was a kid. The gluten molecule, it's now genetically modified. It's too many pesticides are used on it. So that it's not the same wheat as we ate before. It's not ancient grain anymore. It's become it's gone into overproduction because of need of the universe of our continent. People need more and more gluten. That's why the production is high. Production is high. It's made higher by genetically modifying the seed, and then also using a lot of things on the wheat plant, which really is not humanly. I mean, it should not even be consumed from my point of view. But yeah, you will always have this debate about gluten with, and it's very difficult to make people understand why gluten is not what you should have now.
That's a good point that you made. And in your patient population, since you work so much with autoimmune conditions, do you notice any bidirectional axis between autoimmunity and sleep where each is affecting the other?
As I said, autoimmunity is not focused on one organ. It's a multi-organ problem, and sleep per se can be affected just because you're it's like gut-brain connection. So if you have a bad gut, it affects your brain. It can cause you anxiety, it can cause you depression, it can cause you Alzheimer's, it can cause you Parkinson's and insomnia. So it will eventually affect. If it didn't affect today, it will, because it's a direct gut brain connection. You know that most of the 80% of serotonin is in the gut. And if we are altering the gut function in some way, we are making it leaky gut, or we are having SIBO, or we are having inflammation, it's going to affect the sleep, definitely.
And a lot of times people who do struggle with some autoimmune condition, they generally say that they don't have gut issues. So common thing that you hear is, I have no issues with my gut, so why should I bring attention to my gut? And it's hard to make people understand how the gut is actually linked to everything else. So is there a way that people can understand how gut issues impact everything, that are symptoms more than just digestive symptoms when it comes to the gut?
Yes, very good question. In fact, I was also going to make an Instagram video on this particular subject, because people, when they come, if they don't have a bloating or indigestion or constipation, they think the gut's okay. And a lot of my colleagues will also dismiss it. Okay, forget it, the gut is okay. But the point is not that. Point is, if you even have a insulin resistance, your gut is not okay. If you have overweight, your gut is not okay. If you're overweight, gut's not okay. If you are having allergy, gut's not okay. You're having a headache, gut's not okay. So you see, everything points to the gut is not okay. So everybody has to realize that every illness that comes to your body starts with your gut, because whatever toxin you put in your mouth, whatever is not excreted, it's still in your circulation and it's causing inflammation. So it's very important to pinpoint the gut inflammation, because that's easiest to treat also. So people have to understand that every illness on this planet is coming from the gut. Everything.
And we commonly hear the term leaky gut, and leaky gut is dismissed in the medical world as something which doesn't exist. So I usually like to talk about intestine hyperpermeability, but would you be able to break down what is leaky gut and where might the problem actually begin?
See, leaky gut means nothing but there is villi present on the lining of your gut, and those villi are like the sentries, right? They will either they'll reabsorb the vitamins and the minerals from your food, and they will push out the things that actually harm to your body. So what happens is this phenomena gets damaged with excessive toxin abuse. So it can be a toxin like a gluten, right? Gliadin. Okay, so it can be harmed, and that villi lining will break, and that means that the things that you should have actually excreted are coming back into circulation because the barrier is broken. So this is simply as a broken barrier getting things into your body which are actually should have been excreted in the first place. So this is what is leaky gut, and that is what is, like you said, permeability. So there's this membrane with villi on the gut lining. So that membrane is damaged. It gets these tiny holes in it, and then things escape from that holes. The micro, the micro toxin comes back into your circulation without you even realizing. And this is like happening every day. You had one insult of something. Let's say you had a gastric infection, like gastroenteritis, very common infection, right?
Yes.
Very, very common. Everybody gets it. India, you get it so
yes,
often.
Yes, absolutely.
So a simple insult of that nature will damage the lining. And if you did not take care after gastroenteritis episode, your lining is gonna get withered down further and further and further till some autoimmunity sets in. And that's when, everything goes wrong. So leaky gut is the first step towards towards a dysfunction of the body. It can be any organ. So even even in Alzheimer's disease, leaky gut is the first thing to start. Then you get all these issues with, I don't know if you've ever read Bredeson's protocol. Dr. Bredesen has talked about gut as your main area where the Alzheimer's starts.
Yes.
Right. So then I fail to understand when so much is happening through the gut, and this leaky gut, it should be recognized as something, and it is something such a common sense. I don't see why the traditional medical practitioners will dismiss it, because it is such a common sense thing. Even if you tell a 12-year-old kid and tell them, this is how our gut is, even they'll know that, the villi, there's villi everywhere, right? All the tracts have villi. Our throat has villi, our nose has villi. So these are all protective, but they will either fade away with age, or they will be taken down by toxin insults.
Yes, and I think you also made a very pertinent point about gastroenteritis being so common, and you mentioned people don't really take care post that kind of infection. And I must also add that in India, it's very common for people to self-prescribe antibiotics for something like a GI infection. And I know so many friends who just prescribe for themselves.
Deepa, I can go on and on about the antibiotic self-prescription in this country.
Yes, I would love to talk about that, because that is an alarming problem. And I think I've given up the battle in many situations where I've just stopped talking about it. But I'd love for you to share your thoughts about that.
Yeah, so it's very common, you get a little bit of a loose motion, and I don't want to take the names of antibiotics, but I know that people will call the chemist. This is what happens in our country. They call the chemist, I want this and this, and then they'll do a course of it. You see? Now, who knows? Now, we don't know what the bug was, right? Sometimes it's just a loose stomach because you didn't digest properly, or you have to actually let the toxin flow out. And the point is, unless you have a fever, you shouldn't be taking antibiotics.
Yes.
Unless you have typhoid, you shouldn't be taking antibiotics. And antibiotics, one course of antibiotic takes your gut 10 years behind, probably even more. So you have to be very careful when you do. Even a single pill can take your gut many, many days to recover, because it just kills your good bacteria right away. It is lethal. And unless you're not really sick in ICU or in a hospital, antibiotics over the counter should not even be allowed. There should be a prescription from a physician, actually, and then the chemist should be able to give in our country, unfortunately, prescription is not required unless you're on some mental medications, like a sleeping pill or antidepressant. Only then a prescription is required. And that bothers me because I am giving somebody, so giving a wrong antibiotic again causes resistance, right? So if you're self-medicating, you're also causing resistance to your body, so that next time if you fall sick, that same antibiotic is not going to work for you because you created resistance, because you didn't dose it properly, you didn't take it for the right amount of days, or you overdid it. So there are so many aspects to antibiotic consumption that people don't even realize how bad the gut simply, that is a setting of a leaky gut. That's a setting of a leaky gut, because antibiotic is also a toxin. Just because it comes in therapeutic doses doesn't mean it's not a toxin. It's, a drug can be a poison, a drug can be not a poison.
Yes.
But I feel most of the time overuse of antibiotics is just poisoning yourself.
And on that note, Dr. Hooda, I must share an incident that occurred with me, because we were talking about physicians, and I actually had a physician in one of my yoga classes, and she was a student of mine. And every time I would go to teach and my nose was stuffy and I was just getting over a common cold, she would push me to take antibiotics, saying that the cold was not clearing. And typically, I'm of the impression that you just let it run its course, whether you take something or not. Unless there's a chest infection, you shouldn't mess around with that. So we also have the other side, where sometimes physicians themselves are prescribing antibiotics quite loosely. So that's an alarming trend as well. But I'm glad that we raised some awareness in this, because it's been bothering me bottling this up and unable to speak to anyone who wasn't Indian or an Indian practitioner. So I'm so glad we went into this. But let's come to looking at leaky gut itself, because it plays such a big role in sleep, as you mentioned, serotonin. Where do we begin? If we have any idea that we need to be working on our gut? If we've got symptoms, be it digestive symptoms or any other symptom, where do we begin?
I think the beginning has to be when you you actually look at yourself and feel that you're not well. Some people keep living unwell. So a lot of the times here in India, as well as other countries, sick care is more prevalent. So unless you're really sick, you won't go to the physician, or you won't, bother going to the hospital. Well care is something that, okay, I am very aware of myself and I don't feel good. 1 day, 2 day, 3 day, I need to, take someone's advice. So that kind of approach has to come from the people. It has to come, because some people, like, let's say, for example, there is a pain in your leg, for example, right? But you keep living with that pain. You don't want to find the root cause and fix it. You keep living with it. Maybe you will pop in some, pain meds, etc. But you're not looking deeply into why that's happening. And that's the main way people are avoiding getting well. Because if they were not well, and if they had actually gone to a practitioner, a functional practitioner, and said, listen, doc, I'm not feeling well, something is wrong, then it's our job to find what's wrong. But if you don't approach anybody, I mean, I'm okay with even going to an Ayurvedic expert and saying I'm not well, but you have to know you're not well. And when you're not well, a simple thing like pain, like I mentioned, it can take away the sleep. It's simple. Yes. I mean, it is that, because a pain will cause, anxiety. Anxiety will set in as an insomnia, and that vicious cycle just doesn't break. So that's why you have to recognize yourself. Okay, I don't feel good, mentally, physically. people just, they'll just have a sleeping pill. Okay, I'll just have a sleeping pill and be done with it. But that's you're numbing your own brain, you're numbing it for future. You shouldn't be having sleeping pill to sleep. That's wrong. You should be having a restful sleep because your body feels good, your digestion is good, you're pooping daily, you're exercising on time, you're drinking enough water, you're eating nourishment, not just food, nourishing yourself, and that's what is a healthy body. But if there is only one parameter also out, I think you should consult a practitioner.
And would you recommend some basic guidelines to get started for anyone who's just wanting to start that process of lowering systemic inflammation and giving their body an opportunity for gut inflammation to reduce?
Yeah, the very good starting points is a basic elimination diet where you eliminate gluten, dairy, peanuts, the usual offenders. And those are available on the internet. You can always find one. Even IFM, I think, has put some of the, I could see some stuff online, but elimination is the easiest way to start, because if you do 21 days of elimination, I think you're pretty much sorted. Then of course, if you don't get better, you have to seek more help, but the basic is this.
And we spoke about gluten earlier, so I'd love to also ask you a question since you mentioned 21 days. And is gluten something that you consider reintroducing, or is it a food that you feel is to be avoided overall in the context of autoimmunity?
No, so if you're not well and you're doing elimination diet, there is no reason to not get back on gluten. You can if you want. But if I really need to pinpoint the inflammation, I would need to do some testing. And then I would decide whether this person should go back on gluten. But for let's say for long-term sake, if you already have an autoimmune condition, never go back on gluten. That's my 2 cents on it.
Lovely, Dr. Hooda. Do you have any final words to share for someone, maybe in terms of a nighttime routine, something to get started on just improving the quality of sleep? Because you did mention a valid point about restful sleep without needing sleeping medication. And India is another space where you get easy access to sleeping pills, and therefore people are just self-prescribing that as well. So that was a very key differentiation that you made. So is there anything that you would suggest to help restore deep sleep without the need for these interventions like medication?
I think the basic thing about sleep hygiene, which is very undersold by many people, sleep hygiene is something which, people don't even bother about that. They don't even go to thinking about what is a sleep hygiene. Sleep hygiene is simple. Very, very, I'll give you some pointers. I don't know if it'll help. So number one point is, when you are retiring to bed, dim your lights, at least an hour before. Well, your brain needs to know that you're now on low light and it's time to pack up. Dim your lights, read something. Do not drink any caffeinated beverages after 4 o'clock, 4 p.m., if you're a nighttime sleeper. And do not eat a heavy meal before sleeping. A lot of people think that if they don't eat carbs, they can't sleep, but that's completely untrue. Make sure your workout is at least 4 hours before your bedtime, because if you do it very close to bedtime, it's possible that you're in activation mode, in a fat burning and a muscle building mode, and you will not be able to sleep because the body is concentrating there. So you do these things. And then I also suggest playing some nice music in the night, which I think most people can do. It's very easy. But these are the basic sleep hygiene things that it needs to be practiced. There's a lot of healing with breathing. I don't know if that's something you ever thought about, but a lot of breathing exercises, a lot of things that relax you. Don't watch news. Don't fight with your spouse. Don't fight with your kids. Everything that is done after 6 p.m. in the evening will definitely it will delegate how your sleep is going to be. So you have to be very mindful of these changes. So sleep hygiene is amazing thing that if we can practice four or 5 points of this, and if you can practice it, then nothing like it. You don't need meds, but people think they want to switch off in a second, but it takes about an hour or something, 2 hours for your brain to completely get away. From when you switch off a gadget, it takes about 1 to 2 hours for your brain to actually come into that restful mode. People don't realize this. They will end up they'll switch off the phone and they'll wait for half an hour. I'm like, oh, I still can't sleep, so go back to the phone. It doesn't work like that. It's like a full 2 hour thing. If you want to do to your body, it takes about that much time. Logically, medically, it takes about that much time to come to a restful mode because of all the adrenal activity that's going on when you're looking at your phones and news and whatever.
And you made such a beautiful point that these are underutilized tools. I think that's so right, because I see often people searching for complex protocols on the internet when the basic cleanup, like a nighttime routine, hasn't been set in place. So that's a huge point, and I think people should begin with all these simple steps before looking at anything deeper. And we've got a show mantra which we have all our guests complete. If sleep is the new medicine, then how would you complete that sentence for us?
I think there are 7 habits of a human being that are all medicine. Sleeping is definitely one of them, because if you don't sleep, you don't recharge. Sleep is something that there are glial cells in your brain, and I'll just give a scientific thing to it because that's how people understand more nowadays.
Sure.
So there are like microglia, right, in your sleep, in your brain, and they are like the detergents, right? They're like the detergents of they wash out the muck and they basically recharge your brain. All right, these are glial cells. So they're like the what do you call? How the detergent? I think I mentioned detergent. So they're like the detergents of the brain. They wash it, but they only that happens only in sleep. So you don't expect to have a fresh brain without sleeping at least 7 to 8 hours. So if you want your microglia, the glial cells to work, to act as detergents, they need you to sleep. So I think this is all I'll say.
Perfect. And where can people find you, Dr. Hooda, to know more about? You mentioned Instagram, so I'm sure there's lots of videos for people to look at, or your website.
Yeah, my website's under construction. I've just introduced new stuff. So that's under construction. But yes, I am definitely on Instagram. I post out a lot of videos. Some are fun and some are knowledge based, and some can be just random because it's not a business profile. But yeah, I like to talk about things. It just doesn't have to mean it's medical, but it can be anything that will help, motivate, make people learn, make people seek good advice.
Lovely, Dr. Hooda. Thank you for your time and sharing your wisdom with us today on the podcast. And I hope all those big recommendations which you made, from the most simplest of aspects which people are missing, strikes the chord in several people, especially in India, and helps them to move past their chronic health issues.
I'm glad to be on the podcast. I think we need more and more people like you, and we need to spread the word, because health is not something that we should take as granted. It can definitely get better every day.
Hey everyone, I hope you enjoyed the show. Just a reminder that this podcast is for information purposes only. This is not a substitute for professional care by a doctor or otherwise qualified health professional. This information is provided on the understanding that it does not constitute medical or other professional advice or services. If you are looking for personal help on your health journey, do seek out a medical practitioner. Please do make your own healthcare decisions based upon your research and in partnership with your doctor or otherwise qualified healthcare professional. It is in no way intended as medical advice as a substitute for medical counseling or as treatment or cure for any particular health condition. Be sure to always work directly with a qualified health practitioner before making any changes to your diet or lifestyle that may feel out of your realm of comfort or understanding. If you are looking for an allied functional medicine practitioner, do seek out more information on www.phytothrive.com. It is important that you have someone who is qualified and understands your health personally in order to provide adequate care, especially when it comes to chronic health conditions.